Dr. Brad Hall, we couldn't be more pleased that you've decided to join the Ultimate Sacrifice team. You know, as you know, we take care of wounded and injured and families, of course, of deceased heroes such as firefighters, law enforcement, and U.S. military. And we were extremely humbled when you and your team reached out to provide services to our injured heroes, especially the ones that have lost limbs or who have been critical injury with back injuries and so on and so forth. So we just can't tell you enough how happy we are about that. And maybe you could share with me what prompted you to approach us.
Number one, it's an honor to do so. Number two, I feel like it's a calling to me to better serve not only the masses in general, but these special groups of interest. Coming from me as a U.S. Army veteran myself, it was easy for me to acknowledge and have empathy for these types of people. Not only that, but it was easy for me to be a better me, a better doctor. And the best way that I could do that was to show some of my humanity and give back. Give these groups of special interest, let them know that I care and that I have their back as well. For me, it was just that simple. That's why I'm here.
Well, I will tell you, we have several law enforcement professionals and firefighters who are excited and cannot wait to get in here and have you fix them, so to speak. Maybe you could show us around the facility and tell us more about this great company and the work you do.
So we're located here in Dallas, Texas at City Place Tower. I'm directly attached to Laird North Fitness, so we have reception here areas for Laird North Fitness. There are gym membership as well as within the corporate structure.
So how or what is it specifically that you're going to be able to do for our injured firefighters and law enforcement who have been critically injured and have lost limbs such as legs? How does what you do and how does that impact their quality of life moving forward?
That's it. They're just finding their key values and their conditions that they're limiting themselves in just normal activities throughout their life, whether it's bending over and picking up something off the floor or simple as being able to throw a ball with their children. What those things that their conditions prevent them is the key importance of treating any individual. The pains and aches and getting them out of pain is going to come inherently, but being able to give them their function and then their lives back is what's most important.
Well, one of our firefighters that you're going to see shortly, Trevor Toberney, 28 surgeries, 20 before he lost his leg, and he is indicating to us that he, in his back and hips, he's in terrible pain. And again, I'm not a professional in this area, but it sounds like he's all out of kilter, for the lack of better nomenclature, you know.
Absolutely. Within just that patient and that condition in itself, that's changing his gait, it's changing in the way he's walking, that's changing in the way he's standing. So then that translates up into the pelvis and then ultimately to the low back, and then providing, like I said, that function, that ability to do those things that is limiting him. That's the key importance.
Well, I know we're excited, and he's very excited that you've, so willingly stepped up to do this for these heroes.
It's an honor.